Welcome to Voices in Leadership During a Crisis. I'm Bob Blendon, Professor of Health Policy and Political Analysis. And before I introduce our distinguished guest, I want to take a minute for background here. We are in the middle of a global crisis in a pandemic, very different than many of us have seen in our lives. We have switched our regular program on leadership to focus on people internationally and nationally who are bringing an incredible amount of experience to trying to address this threat to the world. And we've changed the focus, and now we're focusing on this crisis, but we're trying to get at a small number of issues. The choices that countries and states make in trying to address this. And if you've been following this worldwide, it's not the same in every country. The lessons learned, we're not at the beginning of this. There are a lot of experiences that countries have. And thirdly, we want people to have some insight in the challenges. This is different. There are political, communications, managerial, and economic implications of making choices here. And so we're trying to cover this, but the importance I want to say to the audience is we're doing this for you. We want people to be able to make judgments themselves as this crisis goes along about what their leaders are or aren't doing, and have really views themselves about where their communities and their country has to go. With that as background, I have the pleasure of introducing Dr. Patricia Garcia, former Minister of Health of Peru, former Dean of the School of Public Health, and a global leader on really dealing with major public health issues. Patty, glad to have you with us. It is a pleasure. I wish it was around some other set of circumstances for that. We're going to turn it mostly over to you, but the first question is, where is Peru in responding and dealing with this incredible pandemic?
Thank you, Bob. And thank you for the opportunity of sharing a little bit about what is going on in Peru and the experiences that we're having. So Peru started relatively early to prepare for this epidemic. By February the 2nd, the Ministry of Health had approved already a national plan for preparation and response against COVID. And by the end of February, in the Latin American region, specifically in Brazil, we had the first case. And by March 6th, we have the first confirmed case of COVID in Peru. And very rapidly, the government decided to take actions. In a few days, schools were closed. Actually, universities were closed. We have this ban for all activities that represent groups of people. And by March 16, we had a complete lockdown. So I can say, and I think this was one of the good things about Peru, is that Peru's response was really fast and was right on time, okay? And actually the reason why those decisions were taken is because we realized all the weaknesses that we have as a country because of social norms and social and cultural norms that in general go against social distancing. And this is something that we share in all Latin America, okay? So we're people that like to be together, close to each other. And we have also extended families. So social distancing is not something that is in our concept. So that's one. The second thing is that we were concerned about the weaknesses of our health systems, okay? At the beginning of the pandemic, we realized that, I mean, how bad we have been doing because we had only 100 ICU beds available for the whole country, wow. Okay? Which means, I mean, and everybody realized we have to do something, at least to try to buy some time so we can do something with the health system. And the third situation that had to do with this decision that was placing people in front of anything, okay? So of everything, actually, the health of the people in front of everything is the fact that we have our society, although we have been growing fast economically, okay, we still have to deal with this issue of a very high percentage of informality. So we knew that this was going to be a difficult situation. A complete lockdown was started in the country. So, however, I mean, not only those decisions were taken, but also there were some decisions that were taken from the point of view of the economy, realizing all the informality. There had to be some ways of assuring that the people that had to go to the streets to get the money that they need to eat could stay home. And so using our, because we had some money left from this boom, economical boom that the country had, it got taken also to try to keep, I mean, as I said, the response was right on time, but there were things that hampered that response, okay? And initially we were seeing that the numbers were still going down, but slowly, okay? And even when we were in the lockdown, still infections were still going up. So that was showing you that people that got the virus during the lockdown, which means that they were not respecting the law, okay? And so the government started to introduce much harder things like the curfews. So we have a curfew at night that started initially at 8 p.m., but then it started at 6 p.m. in the afternoon. And and then the military and the police went to the streets to assure that only one person in each family will go out to buy food or to go to the pharmacy or to the hospital. There was no public transportation, but also that meant that people got a little concerned about what was going on, and we started having all these people going to the markets with a lot of people not following the social distancing. And you know that at some point, and this is, and I think that has been one of the biggest problems, that people are not disciplined. So at some point, we have more people that had been taken to police stations because they were not following the rules or the curfews than the number of people infected. And right now, it's kind of, I mean, we have been able to flatten the curve. I mean, if we see what it would have been if we didn't take these measures, okay, and what we have right now, there is a big difference. But we are not in the ideal situation that we would have liked if people would follow the rules. And that's what we have to deal with right now.
Are there any lessons of how you could encourage people to follow those rules a little bit easier, or this is just a difficult situation?
Well, I guess, I mean, there were several things that were done. I mean, the president took a leadership position because he was prioritizing the health of the nation, introduced this rapid response, and by himself, every day at noon, he was explaining what was going on. He was showing people how to use the masks, okay? The Minister of Health was showing how to use from the government to the public, okay? That there could have been much more social media directed to people, but it has been hard, I think. One of the things that probably could have been done better is, although we had all these bonuses that were supposed to be given to the people with low income, we have realized that we don't have a very good system to identify who really needed this, because everybody, I mean, we have like 70% of informality, okay? You can imagine that. So we know that people that are very poor, those are having this health insurance, comprehensive health insurance, but we have a very important group of people, including migrants, and this is something that we share with several countries in Latin America, migrants that have come from Venezuela in these past years, that are part of this informal group of people, okay? And they probably they didn't receive the benefit of these bonuses. Plus, we realize that we don't have a good system to identify them and to reach them with the money that they needed. So people had to go to the banks. And then that's where we saw also, again, some problems, because there was a lot of people all together
in line,
and organizing them was very difficult. So we're realizing the fact that we need to have better systems to, I mean, to introduce all these people that are in the informal sector into a more informal sector, to be able to reach them with the bonuses, with the services. And we need to move into a different banking system, maybe internet and cell phones, that we had, but just for very small portions of the population. So this is a huge challenge.
Yes.
And the other challenge that we have seen is, you know, for decades, people from rural areas had been migrating into the big cities. Lima is a mega city with 1/3 of the population, okay? And all these people, once everybody was in lockdown, after the second month, they didn't have anything to do here. So we started to have this exodus, this migration from people from Lima to the regions, which is something that we are facing right now. This has happened in the past 2 or 3 weeks, and we are worried of what is going to happen, because although, I mean, and this has not been made in the right way, because there were mayors of the regions that were promoting people to go back. Some of them, maybe because they really were trying to do good, some of them for political reasons. But instead of in quarantines before going to their rural towns, they were just taken. Some of them had tests, just rapid tests, and they were left here. But as you know, rapid tests are not immune passports or health certificates. So once they were in the regions, they were taken to these rural areas, and now we're expecting that we will start seeing new cases in areas where we should not have disease.
So could you have done anything differently?
Well, I think,
because this is an issue all over the world of people seeing the out-migration from the big cities.
Yeah, well, I think social communication is one of the issues. The second thing is, although there had been leadership, I think we're still, there should have been, I mean, I know that there are other countries that are suffering much more, local governments that are trying to do so unite response. But I think that's something that was missing. And the other thing that was missing, see, on one hand, as a country, we did not have capabilities to do molecular testing, but we were lucky that very early in the disease, we realized that maybe serologic tests could help us. And actually, we were able to buy serologic tests. We bought like 1.5 million tests when nobody in the world was paying attention to that, okay? Absolutely. Which was good, which was very good, because initially that helped us in the identification of cases and contact. Our systems to try to contain those that were found infected, those have failed, unfortunately, okay? And so although we were identifying them, it was difficult to isolate them because people had to go out to eat or to do or to buy medications, etc. And we have realized that we don't have good social protection systems, especially for the most vulnerable and for the elderly, for example, okay? So we have been using these serologic tests, which had allowed us to see the symptomatic cases, but now we're using them also to see the people that are asymptomatic, and we are even testing other populations, people in the markets, military, police, all these people that are traveling, okay? Which is making us look like we have much more infected people, and we do, compared with other countries, just because we're doing much more testing, and we're even testing people that are not symptomatic, okay? But I think we're also abusing and using the tests in the way we shouldn't sometimes, like, for example, with this exodus of people. So I think it was good to do the testing, to find the ones that were positive and left them in Lima for a quarantine. But the ones that were negative, it was a completely wrong concept to consider that they were clean or they had a certificate to just travel and go to the rural areas. There should have been also quarantine for them, even if they had a serologic test that was negative. And that's one of my lessons, and I think a lesson for other people that are starting to use serologic tests. They are quite good to increase access, okay? Especially if you want to find symptomatics and you don't have molecular tests, you can use it for contacts, you can use it for vulnerable populations. But if you find a positive, fine, quarantine them, try to identify contacts, etc. It can give you a lot of epidemiological information that is good and can help you clinically. But if a person is negative, you have to understand the whole concept and the risks that are behind. And you cannot consider that just a healthy person, because every single person outside the place where I'm in quarantine can be infected and can replicate the disease.
And so if you knew that ahead of time, what would you have done differently?
Well, you know, at this point, my role here in Peru as an ex-minister, and that this is an interesting thing that Peru has done also, the Ministry of Health has created different commissions that are kind of advising commissions. So yeah. I'm chairing a commission that has to do with innovations in technology for the response of COVID. So in this commission, I work with about 16 scientists, molecular biologists, engineers, etc. And we're trying on advising of how to do things better, okay? But as an advisor role, the best that you can do is tell this should be done or this cannot be done. And sometimes it is hard, okay? You have the evidence, but this is a time in which nobody is working using evidence, unfortunately. There are political issues, there are economical issues that are always going against public health. Right. In Peru, so far, public health has been over, but these issues, I mean, at the beginning, nobody wanted to do the serologic tests, but then now everybody wants to use it. So what we're trying to do is we're trying to give evidence, we're trying to raise our voices. I'm trying to talk with whoever I can. And sometimes it's hard. Sometimes you can get the message ongoing. So I'm working also with some global experts. We just had a webinar in different languages, one of them Spanish. So we're trying to teach the right way of using serologic tests. I think what I would do better, maybe I will raise my voice harder, but I think sometimes it's difficult when it is a new thing. There are recommendations that this committee has done that initially were not heard. Like, for example, the community use of gloves. We were seeing that everybody was using gloves in the community. So the whole committee, I mean, we wrote recommendations of not promoting this. WHO has said so. I mean, people are forgetting about the importance of washing their hands, of using alcohol gel in the markets going out, because they feel that the gloves are doing everything. But still, there were some guidelines that came from the Ministry of Health regarding community use of gloves. So we started going into the media, and actually I even sent a message to the president, but finally those guidelines were changed from the morning to the afternoon, and now we're fine with that. But there are some other the use of rapid tests, which I think that is making this mistake of trying to use serologic tests as immune passports or health certificates. I mean, that's something that needs to be erased, and I hope that the message will come out.
So I'm going to ask you, because we have an audience that's trying to figure out what is it that those tests can or cannot be used for. So if I'm listening, I know exactly what I should be saying in the next conversation. What should somebody listening take away on the test issue?
Okay, so, and this is a very interesting and very important message, okay? Serologic tests can and should be used, number one, to identify symptomatic, or if you don't have the capabilities of using molecular tests, to identify cases, okay? Because it could complement the issue, especially if, for example, one thing that was happening in our country was that by the time somebody was calling because they were having symptomatic symptoms, right, and the whole team was going to their houses to do the testing, it could have passed 4 or 5 days, okay? So doing the serologic test first could give us, by that time it would be positive and could save us one molecular test that could be used for somebody that is seen much earlier.
Yeah.
If the serologic test is positive, that's fine. We consider that a case. And we could use the serologic tests for the contacts. So identification of symptomatic cases and contacts is a good use, especially if you want to increase people that are infected in markets. So we have some markets in which we have found 90% of the
Yes,
people
right.
selling in the market that are positive. And some of them were not honest enough to say that they were having symptoms. They wanted to make their lives, selling, and they were using the mask, yes, sometimes, but they were part of a chain of infection, so second use. Those two uses are very clear, but what you should not be using them for is, number one, for example, to use it as a criteria for, we call it, because we're starting to learn about immunology, is that IgM and IgG can both stay for a long time. So we don't understand enough to use it as a discharge, a tool for discharge patients from hospitals. That's one. And the second thing, we cannot use it to tell that somebody is immune or that somebody is healthy, because we have these windows in which people can and still have the infection, but still has some of these signs in the serologic tests that may look like he's infected, but he's not. So not certificate health, a passport for technology passport. Two things that yes, and two things that you should not be using it for.
But that's critical because a lot of countries, including the US, is discussing sort of certifying people to be able to go to work or travel or everything else based on the test. And you're suggesting that will be a real problem.
Yeah. I think, be it or not, what we still need to take into consideration is this issue of the quarantine, okay? So therefore, it's different if you have that and you can follow that safe 14 days of quarantine before anybody goes back to work or go back to move from one place to the other. We have to be very, very careful. So now in Peru, we're facing the situation of a curve that is not as high as could have been,
right.
Is not as low as we would have liked, and we're going into this flatten. We are going into the plateau, okay? And this plateau is taking several days, but we think it's a mixture between what is going on in Lima, which is where the epidemic started, okay? And the new epidemics that are starting in some areas of the northern part of Peru or on the jungle, where social distancing was routinely flouted. People didn't believe on that, and now they are suffering because of that. Yeah. We have been able as a country to increase our capacities from 100 ICU beds to about 1,000 right now, okay? We had some hospitals that were not finished, so we took some of the equipment that was there and put it into action. We had some ventilators that were not working, they had been repaired. We had some groups, academic groups that are producing new ventilators. So we're in that flat plateau, And we're aiming that this will go down, and we're in the point in which we're going to start making decisions, and we're starting making decisions to start some economic activities again slowly and see how it goes. I think we're gonna go from a quarantine and a complete lockdown to a more voluntary quarantine that will, we hope that will be more intelligent, with more social communication, and people, we hope that will realize the importance of social distancing, masks, hands, protecting the vulnerable, and then to have some localized actions. Definitely areas in the north and in the jungle still need to have the lockdown. We still need to move professionals and health professionals and all the supplies that we can into those areas. And we, you know, one of the things that we have been suffering as a country is the fact that we are a small market. We had some money, but we could not get supplies for tests or EPPs because, I mean, as a small market, we don't count in the world. So we have realized about the importance of start investing in research and biotechnology. And that's part of what we are trying also to push. I mean, how can we start creating capacities within the country to try to solve our own situation and be and help this response and maybe prepare for the next pandemic. It has been hard. And it has been hard to advise in this situation. It has been hard also to go from good measures into implementation and make people really follow them. And right now we are dealing with how to open this quarantine because the economy needs to start moving. Otherwise, we will not have enough resources to keep fighting the pandemic.
So go further with me, because half the world wants to know how you're going to handle this. Because it is the question all across Europe, across the United States. How do you sensibly move from the lockdown to some opening up without pushing the curve back up again?
Yeah, well, I think we are all trying to learn from each other. I think we will need to go slowly. And as I said, this is not one epidemic in a country. We're having several epidemics and we need to move day by day. And there are several of us that are looking at the numbers, at the strategies. It is a complicated issue. We're working also as part of a world group with WHO on this randomized trial of therapies that could be used. And this is an evolving issue. So although Peru started early, I think things could have been much worse if we didn't.
Yeah.
We're still facing the fact that there had been decades in which we were not investing really on public health, and we have not been investing on biotechnology and science. And thanks God, I think the country and the government is realizing that. So we'll see what it happens and we'll keep you informed.
In closing, if you were advising the next Minister of Health in Peru and you had to give them two pieces of advice, what would you do? Or it's impossible to give just two.
Yeah, so number one is social communication. I think we needed to do much, much better. I think we have had this infodemia that has come with myths and several things that have been against what we would have liked. And so social media, this issue of social communication, a much harder social communication, that's one. And the other thing that I think is put a lot of effort, not only on writing norms and plans, because we have lots of norms and plans.
Yes.
I think we're the country that have the most, okay? But putting much more effort on implementation and adding more key actors, because academia has been added, okay? But I think we need to also listen much to academia, and the other sector is the private sector also, which is very interested on, I mean,
right.
We are trying to work all together, but I think we need to work it harder.
All right. I think we're about to close out. On behalf of our audience, are incredibly grateful that you did this. This is very different than many other issues we've covered, that people in various leadership positions around the world are trying to make judgments about what their next step should be. And it really helps here outside. Likewise, we talk with some amusement, a number of the US media covering Peru paid no attention to the amount of testing you did. And the amount of testing leads you with more cases.
Yes.
And so it's important that journalists understand that there is a denominator piece to this. And that if you screen everybody, it's going to look like, and there has to be other measures about how a country's doing or not.
And Bob, there is one more thing also. I mean, when we count, for example, people that are dead, or, I mean, we are counting those that have molecular tests, those
Yes.
that have serologic tests, and we're even counting those with clinical conditions. And when you compare that with other countries, they are just considering confirmed cases. We're trying to get all the information to have the whole picture, the maximum picture. So when we are compared with other countries, I mean, we kind of like look like we're doing worse. We know that we have a problem, but I think the fact that we took measures early had allowed us to have a much better response. It's not the perfect, because we are a society that needs to learn about public health, about discipline, and about, I mean, sometimes social distancing. We're warm people, like to be all together, but sometimes that goes against public health issues, and that has been very difficult. Plus informality, that's something that we will need to work on in the country. So I hope that will be an opportunity of changing, hopefully.
Yes.
If we go against this.
And I hope our broader audience can take away some lessons as they look at their own situation, because we have to go forward here, and you have to learn from these experiences. Again, thank you very much on behalf of a very broad community watching the school itself, and myself, the privilege of having a chance to interview you.
Thank you so much.